laparoscopic sleeve gastrectomy is now the most common procedure being used for morbid obesity. This procedure is offered to patients who are over body mass index 35 and are suffering from diseases like high blood pressure, diabetes, and other problems like sleep apnea, high cholesterol. The procedure actually falls under the group of procedures which are restrictive procedures. Restrictive means you are just reducing the size or the capacity of that stomach so that once you've done the procedure, the patient will be eating a much smaller amount, will be feeling less hungry, and every time he or she takes a meal, she'll feel full much faster than, much quicker than normal. Because one of the main problems with the obese patients is they have quite a large part of the stomach called the fundus, which is what allows them to keep on eating without feeling full. So it's most of the fundus which we remove when we do a laparoscopic sleeve gastrectomy. It's usually a procedure which we, of course, pre-operatively prepare the patient. We do the investigations, we optimize them, we advise them on stopping smoking and all those things which we ask patients to do if they are to undergo such a surgery. We prepare them mentally to be ready that after the procedure they will be on a specific diet for 5 to 6 weeks before they go back to a normal diet, though their portions will become smaller. And once we have investigated and the patient is ready, the patient comes. Unless the patient is having severe comorbidities like heart problems or renal problems, then we would admit them a day before. Otherwise, if it's otherwise a fit patient, no serious comorbidities, then they walk into the hospital in the morning on an empty stomach. We take them into theater. The procedure is done laparoscopically, where they get 4 punctures on the abdominal wall, through which we pass, and the fifth puncture, there is a 5th puncture for retracting the liver. We pass our instruments in through those punctures, and of course trocars. Basically, we use something called an endo-GIA stapler to take away 60 to 70% of the stomach using that stapling device. And the main part which you have to get out in this procedure is the fundus of the stomach, because if you leave the fundus behind, then that patient will still feel hungry, will still want to eat more than necessary. So it's a procedure which takes about an hour and a half maximally, and using this special staplers. And once it's done, the patient is left with a smaller stomach. The first 5 to 6 weeks, you have to allow the area to heal. They have to be on liquid diets, special diets, but after that, they go back to a normal diet, only that they have to avoid the fatty meals and meals with too much carbohydrate, and they have to exercise. So we have done patients who were 130 kilos, and within a year they would go down to 80 kilos. They're supposed to lose at least 60 to 70% of the excess weight in this procedure. So if a patient is 130 kilos at the beginning, but by the height, that patient is supposed to be, let's say, 65 kilos. So that patient is excess by 65 kilos. So this procedure, the sleeve gastrectomy, will make her lose 60 to 70% of that excess weight in 1 year. So if it's 65 excess, then we expect that patient to lose 40 kilos by the end of 1 year. And then we let them continue their lives, and we follow them up, might be once a year.